My name is Reilly Scroggins. I'm an Auburn University family nurse practitioner student. Today I will be performing a head-to-toe physical assessment. I've already washed my hands, introduced myself to the patient, and I'm just going to start out with the general survey. The patient is an adult male. He appears in good health. I took his vital signs, height, and weight before he came in the room. He has a healthy BMI. He shows signs of good hygiene. His posture is erect. When he came in the room, I assessed his gait. It was steady. He shows no signs of physical distress, and he is dressed appropriately for the season. Now we're going to just start out with the skin assessment. Also for the skin assessment, I will be doing this throughout the entire physical exam, but we're just going to do a general one now. Just going to feel on your skin. I'm looking for any lesions, any tattoos, piercings. I don't see any. His skin is white, it's warm, dry, and intact. Now we're going to go on to an exam of the head. I'm just going to start by palpating your scalp. Do you feel any tenderness?
No.
So we're assessing for tenderness. We're looking at his hair distribution. It is even. His hair is soft, no signs of alopecia, no bulges, masses, anything like that. Now I'm going to get you to look at me, and I want you to raise your eyebrows, puff out your cheeks, smile and frown. So cranial nerve 7 appears intact. I'm going to palpate your frontal and maxillary sinuses. Any tenderness?
No.
I'm assessing for tenderness, edema. I do not note any. Now I'm going to feel his TMJ. I want you to clench your jaw for me. Open it. There's no crepitus. His cranial nerve 5 is intact. Now I'm going to assess for, I'm going to feel his lymph nodes. First we're going to start with preauricular, postauricular, occipital, tonsillar, submaxillary, submental, cervical, and supraclavicular. All the lymph nodes felt normal, no tenderness, no enlargement. Now we're going to move on to an exam of the eyes. First, we are going to just take a look at the outer eye. I'm going to have you close your eyes for me and just open them against the resistance of my hands. So cranial nerve 7 appears to be intact. I'm going to close your eyes again, just gently palpate the lacrimal ducts. Okay, good. Before he came in the room, you can open your eyes. Before he came in the room, we tested him with the Snellen chart at 20 feet away. His vision was 20/20 bilaterally, testing cranial nerve 2. Also to test cranial nerve 2, I'm going to have you just look straight forward at my nose. I'm going to have you cover your right eye. I'm going to cover my left. And I just want you to tell me whenever you see my hands.
See it.
Okay, so cranial nerve 2 appears to be intact. I would also do that bilaterally. For the purpose of this video, some things that I would do bilaterally, I'm just going to do on one side. Now next up, what we're going to do is test cranial nerves 3, 4, and 6. I just want you to follow my pen light with just your eyes. Okay, now look straight forward at me. We're going to do a cover-uncover test. So it appears cranial nerves 3, 4, and 6 are all intact. Extraocular movements are all normal. Now also to test cranial nerve 3, I'm going to take a look at his pupils. Just keep looking straight forward for me. And I want you to focus both eyes on this, and then I want you to look at a point on the wall and back. Okay. So cranial nerve 3 is intact, pupils are equal, round, reactive to light, and accommodate for distance. Now we're just going to take a look inside your eyes. Just keep looking straight forward for me. Okay. So the corneal light reflex is intact. I can visualize the retina, the optic disc, the fovea centralis, and the macula. I also would want to just take a look at his eyes externally, at the cornea, the pupils, his conjunctiva, and all of that looks normal. Okay, now we're going to move on to your ears. So I'm going to stand behind you. I want you to just plug this right ear for me. I'm going to whisper 3 words, and I want you to tell me what they are, okay?
Pink, blue, yellow.
Good. Okay. So now we are going to just kind of look at his ears, inspect them. I would do this on both sides. I'm just going to do it on one. I'm looking to see if there's any tenderness, any piercings, anything like that. And I'm going to take a look inside the ears. So I was looking in the ear canal. There's a small amount, normal amount of cerumen. The tympanic membrane, I was able to visualize a cone of light, and the tympanic membrane was pearly and gray. We normally do this on the other side as well. Now we're going to do what's called a Weber test for lateralization. So I'm going to put this on top of your head. I want you to tell me if you hear it in one ear or both ears.
Both ears.
Okay. So that is a normal finding. It shows he has good lateralization in both ears. Now we're going to do the Reilly test. I'm going to put it here on your bone, and then I'm going to put it in front of you. I want you to tell me when you stop hearing it, okay?
No. No.
Okay. So air conduction is greater than bone conduction, which is normal. Now we are going to take a look at your nose. I'm going to have you close your eyes for me. And I'm going to obstruct one there. Tell me what you smell.
Soap.
And again, this side.
Smells like soap.
Yep. Okay, now you can open your eyes up. I'll have you just blow gently. And again. Okay, both nares are patent. Now I'm just going to take a look inside. Okay. The septum is midline. The nasal mucosa is pink and moist. There's no redness, no excess drainage, anything like that. I'm going to take a look at his lips, mouth, and throat now. So I'm taking a look at his lips. They're pink, moist, intact. I'm going to have you just open your mouth for me. Okay, the oral buccal mucosa, lid of your tongue. Good, all looks good. Dentition is intact. I don't see any signs of any cavities. His gums are pink and moist. Now we're going to just take a look further back in your throat. I want you to stick your tongue out far and say, ah. Okay. And lift up your tongue and go side to side. Good. Okay, so we're checking cranial nerves 9, 10, and 12 there. I would normally also check his gag reflex. For this video, we're not going to do that, but if the gag reflex is intact, then 9, 10, and 12 are all intact. Okay, now I'm going to check. Feel your trachea, just relax. Can you swallow for me? Good. And I'm also checking his thyroid glands. His trachea is midline. His thyroid does not show any signs of any masses or tenderness. I'm going to have you just lift up your shoulders. Okay. And I'm going to have you turn your face against the resistance of my hand. Good. Again. Okay. So cranial nerve 12, the spinal accessory nerve is also intact. Now we are going to move on to the thorax and respiratory exam. So first I'm just going to take a look at his ribs. I'm going to just palpate them gently. Just get an idea. His costal angle is approximately 90 degrees, which is normal. The anterior posterior to lateral ratio appears to be approximately 1 to 2, which is also normal. He's not barrel chested. I'm also going to palpate his spine, and I'm going to check for symmetric respiratory expansion. So I'm going to take a good deep breath in and out for me. So my hands were rising and falling symmetrically, so that was good. Now I'm just going to have you say 99 as you feel my hands.
99. 99. 99.
Okay, so I was checking for tactile formitis there, and that was also normal. Now I'm going to take a listen to his lung sounds. I will listen to them anteriorly, laterally, and posteriorly. First, we'll start out with supraclavicular. And for clavicular. Reach your hand up a little bit. Listen. listen laterally. Okay. I would also listen on this side normally. His lung sounds are clear bilaterally, anterior, posteriorly, and laterally. I do not know any adventitious breath sounds, but they all sound clear. Now we are going to move on to a cardiovascular assessment. Actually, first with the respiratory assessment, I want to take a look at his nails, and I just want to note if there's any clubbing, and I don't see any. And for the cardiovascular, I'm going to look at the capillary refill. It's less than 3 seconds. And now I'm going to just palpate his cardiac area. I'm visualizing it. I'm looking to see if there's any heaves or thrills of the cardiac area. I'm also going to palpate for the point of maximal impulse. I do feel at the 5th intercostal space, left midclavicular line, which is right where the apical pulse is. That's normal. Now I'm going to take a listen to all 5 cardiac areas. Normally I would do this with the diaphragm and the bell of the stethoscope. I'm just going to use the diaphragm for this video. So we're listening to the aortic, pulmonic, Erb's point, tricuspid valve, and the mitral valve. Okay, again, I would also listen with the bell of the stethoscope as well. I heard regular S1, S2, no signs of S3 or S4 sounds or any murmurs were noted. Now I'm just gonna feel all of his peripheral pulses. Start out with the radial, brachial. I would also normally do the femoral for this video. I'm not going to do that. Popliteal and dorsalis pedis. Okay, and all the pulses I would grade a 2+. I'm also going to feel on his carotid. You only want to feel on one side at a time. And also his temporal arteries. And we want to make sure as we're assessing the pulses that we're comparing them bilaterally. I'm going to listen to his carotid artery for any signs of a bruit. And also the same for the temporal artery. And I do not hear any bruits. So now we are going to have you go ahead and lie down for me. As he lies down and we move to the abdominal assessment portion, I'm also going to be looking at his jugular vein and notice if there's any jugular vein distension. I'm going to be turning your head to the left side a little bit. Okay, and I don't notice any jugular vein distension. Now, for this part of the video, I'm just going to have you lift your shirt up just a little bit. We're going to start out the abdominal exam with just inspection. So I'm looking at his belly. It appears flat. I don't see any peristalsis, no pulsations. I do not see any piercings of any kind. I don't see any visible masses. So now I'm going to take a listen. I'm going to listen in all 4 quadrants. So vowel sounds are active in all 4 quadrants. I'm going to listen to his aorta again to see if I hear any bruits. And normally I'd also listen to the femoral arteries, but I'm not going to do that in this video. Okay, so I do not also take any bruits of the aorta. And now we are going to do a little bit of percussion. We're going to attempt to percuss over the liver and over the spleen. If you're able to, you might hear a little dullness. The rest is tympany. And now we're going to move to just some light palpation. You're going to be seeing if he makes any signs of grimacing, that's painful, that's tender. We're feeling for any masses, and then we're going to move to deep palpation. Really to see if there's any masses, and also really just to see if we can palpate any of the organs. We're going to attempt to palpate the right and left kidney. And we're going to attempt to palpate the liver and the spleen, although this sometimes is not possible. Okay. Alright, so I'm going to get you to just sit back up for me. You can actually come sit back on the chair. And I'm going to check him also for CVA tenderness now. Is that tender?
Mm-mm.
Now we're going to move on to the musculoskeletal exam. So first we're just going to check, I'm going to feel all of his joints while I'm trying to get him to do a little bit of range of motion. So I'm going to have you just go like this with your elbows. I'm going to just kind of palpate out. Okay, do it again. Okay, good. And I'm going to get you to put your hands out. And I want you to flip them over and back. And I want you to take your wrist and just roll them all around. And kind of feel on your wrist. Okay, and I want you to just open and close your fingers for me. Okay, and now I want you to just let your knees extend out. Back and forth. Good. Just gonna kind of feel on these joints, see if I feel any crepitus. And I want you to point your toes down and up. Okay, good. And now we're gonna test the strength of all of his muscle groups. So I'm gonna have you shrug up against my hands. Okay, good. And I'm gonna have you hold your hand like this, and I want you to not let me pull you, and I want you to push out against me. Okay? And down here, try to push against my hands. Good. And try to pull against them. Okay? And same thing with the feet. Try to push against my hands. Okay. Let your hands down now. So I tested all of the major muscle groups. They were 5 out of 5 strength bilaterally. His range of motion was intact. Now we're going to do a quick neurological exam. We already throughout the physical assessment have been testing most of the cranial nerves. So now there's not too much left to test. I'm going to ask you a few questions. Okay. What is the year?
2020.
Who's the president of the United States?
Donald Trump.
What is your mother's maiden name?
Nail.
Okay. So he is learning oriented times 3. His recent and long-term memory appears to be intact. We're going to test your sternognosis. I'm going to have you close your eyes. I'm going to put an object in your hand. I want you to tell me what it is.
It's a ring.
Okay, good. And the other hand?
Same thing.
It's a ring? Okay,
Ring.
good. So that is intact. Now I'm going to check all of his reflexes. Okay, so we're going to start out here. Okay. We're going to try to do biceps and triceps. Just try to relax your arm out. Okay. And we did brachioradialis, biceps and triceps. Now we're going to do patellar. Okay, and Achilles. Okay, and we also would do test his reflexes bilaterally on the other side as well. All of his reflexes on this side were normal. Now, I'm going to also test to see if he shows signs of the Babinski reflex. Just like your foot up for me. Okay, Babinski reflex was negative. So that's good. If the Babinski reflex was positive, then that would be signs of neurological damage. So now I'm going to get you to just stand up for me. I'm going to get you to, we're going to do a Romberg test now. Lay your arms outside to side and close your eyes. Okay. So I do not note any swaying, so that's good. Now I'm going to have you go stand over here for me. Now I want you to walk towards me heel to toe. Okay, good. And I want you to hop up and down on one foot. Okay, great. And I'm going to have you sit back down one more time for me. So all of his motor skills appear to be intact. Now we're gonna check his sensation real quick. I'm gonna have you close your eyes and I'm gonna touch different parts of your arms and legs with either a soft or a hard object. I want you to tell me if they're soft or hard, okay?
Soft. Hard. Hard. Soft.
Okay. So his sensation appears to be intact. And that concludes our head to toe physical assessment.